Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Dr. Judith Esterquest. Judy is the chair of the Healthcare Issue Committee for the New York State League of Women Voters, and she is a powerful advocate for all of us on healthcare here in New York. Judy, welcome to North Country Matters. I've worked with you for a number of years now on league issues, and I am so glad you can be here to talk to us about league advocacy for healthcare and the New York Health Act.
So, isn't there something about, tell us about yourself?
Yeah. So yes, I was just giving you a minute to say hello to folks, but that's fine.
Oh, that's fine. I had
Yeah.
no idea what we were doing here.
So Judy, tell us a little bit about yourself and how you came to be doing this work for the league.
Well, I'm glad to be here, Donna. So, thank you for that. My husband was seriously ill in the last few years of his life, and we spent a lot of time with doctors and in hospitals. And we got so many insurance denials, and we made so many appeals. And his medical team described struggles they were having with denials and appeals. And when we were in waiting rooms or family lounges, I heard heartbreaking stories from other people who who really were making very hard decisions about what kind of care, not based on the care, but on the finances. And after my husband died, I went through about 2,000 pages of bills and not bills and denials and not denials, and oh my goodness, it was completely awful. I mean, losing my husband was the worst thing in my life, but the health insurance was torture. And after he died, I looked for a volunteer organization to join, and I learned about New York Health, which we'll talk about. And it sounded way too good to be true. So the internet's a thing, and I spent a lot of time researching it. And then at my first meeting with the League of Women Voters, I learned that the League supports it and advocates for this bill. And so I joined the League. And soon I had a team of members for healthcare, specifically single payer public financing to get affordable, accessible, comprehensive, quality healthcare for everyone, because no one should be telling the kind of stories I was hearing. And that led me to be active in the state and national and to listen to North Country Matters, beginning at least in 2020, because rural healthcare is one of the places where you hear the most hair-raising stories. So I'm delighted to be a guest on this program, Donna.
Well, thank you, Judy. And your story of the personal trials and tribulations that you went through, not to mention those that you heard about from people who were waiting in the same rooms you were, is really how a lot of advocacy does get started. Because I've always found that if I had a problem, my assumption was it was not a unique problem, that there were a ton of people with the same issue, and clearly that is what you discovered, and that is why you are such a powerful advocate today.
Thank you.
So, give us an overview of the league's position on healthcare, both here in New York State and for the U.S. League as a whole, because the League of Women Voters is such a powerful voice on issues of public policy.
That's right. We study things hard and then we decide our public policy position. So in the US and New York State, we have three big healthcare goals. We advocate for first, universal health care. That means equitable access for absolutely every resident. No rationing by income, by gender, by race, by ethnicity, with most delivery where people live. Second, comprehensive health care. That means covering everything you need with quality care. So, physical and behavioral, inpatient, outpatient, diagnosis, treatment, prevention, and health education. And then third, it needs to be affordable. And that means affordable for patients, for taxpayers, and for providers. So the league talks about financed through income-based general taxes, not individual premiums, because you never want to worry about paying for health care rather than food or rent or shoes for your kid. And the league wants medical debt to go away. And it believes that healthcare should be separated from being employed. If you lose your job, you don't lose coverage.
Well, those are three very powerful reasons to be advocating for the kind of healthcare that we're going to be talking about today. As you know, Judy, healthcare information and the healthcare information and delivery system in this country is under a lot of threat right now from actions being taken at the federal level. That's going to put the onus on states to ensure that their residents have the healthcare they need to stay healthy. So how does how do you respond to that in terms of the states have to step up and take responsibility because it looks like the federal government is going to fail us?
Well, I try not to worry about the federal government failing, but it certainly looks dire now. And the way I think about it is league goals do not change when administrations change. We advocate for public policy that benefits the public, regardless of political wins. I mean, it took 60 years to get women the right to vote, and the women who won that right are the ones who founded the league. So we play the long game. Like other league members, I try to stay sane by taking action that builds and strengthens community, advocating at the national or state or local issues, like local level, on issues like climate, education, rural issues. My focus is New York State single payer health care, which is like Medicare, only more affordable, with no coverage gaps, and it's for everyone, not just seniors. And in New York State, we have an extraordinarily well conceived and well written bill called the New York Health Act. In fact, one of the Medicare for All bills in Congress used it as a model when they redrafted it from scratch a few years ago.
So that's a pretty powerful statement about how well thought out this bill is. So explain to us, Judy, what single payer is and why you favor it.
So, single payer means that, like Medicare, doctors and hospitals invoice the government, like the state government or the federal government, and they get paid directly by the government promptly. Because all of us would be covered and all doctors and hospitals would invoice a single payer, there would be no networks. We could choose our doctors and our hospitals. And they, by the way, don't work for the government. They could work for themselves as hang out a single shingle, or they can work in partnerships or whatever. Today, our healthcare system is what's known as multi-payer. We don't choose our doctors. We are our employers, choose our insurers. That is, the for-profit middlemen like United Health or Emblem Health. And these for-profit insurers, these middlemen, do not provide health care. They just manage payment streams, usually between patients and providers, but also between lots of other people too, like PBMs. They charge extravagant fees for administrative overhead. For example, Medicare and the Veterans Administration take 1.5 to 2% of our premium dollars or our tax dollars for overhead. And private insurers take 14% to 20% or more of premiums for their overhead.
You know,
So
you talk, Judy, about doctors going to actually be able to work for themselves. I don't know any doctors locally who are independent anymore. They all belong to work through a hospital or somebody else because they can't afford to do the paperwork. That
that
billing it is such a monstrous system with the for-profit health insurers these days.
It's even worse because the for-profit insurers negotiate how much they will reimburse doctors. And in rural areas where there aren't as many people, the insurers will underpay, will under reimburse rural doctors. And that's one of the reasons they are fleeing less populated areas. Whereas you can throw a stone on the Upper East Side of Manhattan and likely hit a doctor or a doctor's office or a hospital. There are so many of them. So yes, so doctors are forced to go to wealthier zip codes, and you don't need 1,000 doctors for 1,000 patients. You do need at least one doctor for 1,000 patients. But anyway, so these health insurers who are brutal in their negotiations, their overhead is 8 to 10 times higher, partially because they have to hire armies of bureaucrats to deny deny and delay claims. You heard United Health was denying up almost a third of every claim that was presented to them. And they also deny and delay prior authorizations. Now, Medicare doesn't really require many prior authorizations. Private insurance will require authorizations for everything. And they want to override your doctor on prescription drugs and treatment. Now, anybody who's argued with these bureaucrats know they've never examined you. They have no medical training, but they have metrics about how fast they have to work and what percentage of claims to deny. So you often get hung up on, even if the conversation is going okay. And this adds dramatically to healthcare costs because doctors and hospitals need armies of bureaucrats to appeal these denials. So one final thing about these for-profit insurers, they're among the largest and most profitable corporations in America. And their armies of lawyers make auditing them difficult. So the government periodically audits them. And when they do, we found that up to 20% of their revenues are fraudulent. But nothing happens because they've got armies of lawyers. I could go on longer, but I won't because all your listeners have likely noticed that in your doctor's offices, there are more billing people than doctors. And anyone who's had a claim denied knows how frustrating it is to argue with claims agents. And in the US, insurers are corporations, and by law, their business model requires them to focus on profit, not patient health. It's why American healthcare costs twice as much as peer countries, and it's why our life expectancies are years shorter and our maternal death rates are 2 to 3 times worse. But our healthcare profits are the best.
So that is a good indication right there that the system needs to change. So, Judy, let's talk about how one state can pass a Medicare for all bill. Has anything like this ever been done? It sounds like a radical idea, but goodness knows we need some new kinds of thinking given the out of control costs in healthcare these days and the lack of delivery of actual healthcare.
So, radical isn't necessarily a terrible thing to be. My dad, who taught history, used to say, states are the laboratories of democracy. And what he meant was that some states passed laws allowing women to vote long before we got the 19th Amendment. And nothing terrible happened. In fact, the state got more people. State laws tested the viability of seatbelts and gay marriage and drug laws and reproductive rights. And all of those were radical, expensive, or just damn scary. And now they're normal. Canadian provinces also work like this. One Canadian province, Saskatchewan, enacted single-payer health care in 1962, despite a tidal wave of TV commercials demonizing it, mostly paid for by the American Medical Association, who did not want single payer in the US because they wanted to protect monopoly rights. Within 6 months, the single payer program in Canada proved so successful that province after province copied Saskatchewan, and all of Canada had similar programs within a decade. So, yes, individual states can change nations. And New York has done this before. And if you consider for healthcare that New York has 20 million people, and if it were a country, it would be the 12th largest economy in the world. It's plenty large enough to support a single payer health system. Many countries do.
Yeah, and in fact, New York's population is pretty similar to Canada's. So if Canada can do it, we can do it for sure. So let's talk a little bit about why the League supports the passage of the New York Health Act. How does this bill will make a difference for individuals in this state?
So, not to be too nerdy and policy focused, but the League advocates for things where the League has a position on that piece of public policy. So, the reason we support New York Health Act is because it satisfies every League healthcare goal. Let me review them really quick. First, New York Health is universal. If you live in New York State, you're fully covered. Everyone gets the care they need. No one is left out. Our governor and legislators get the same health care coverage that Uber drivers and dairy farm workers get. If there's a problem with the coverage, as Dick Gottfried used to say, the governor will want his changed or hers changed, and so the Uber driver will get an upgrade as well. Second, New York Health is comprehensive. You can go to the website, www.nyhcampaign.org, and see the very long list of every kind of needed health care that's covered. Now, I know from studying rural health that way too many poor New Yorkers have lost half their teeth by age 50. But difficulty chewing reduces nutrition and harms health. Similarly, New Yorkers with hearing loss who can't afford hearing aids can become socially isolated. It's one, it's one direct path to dementia, and it's preventable. New York Health will cover your teeth. It covers everything above the head, above the shoulders, I used to say. It includes your teeth, including cleanings, dentures, surgery, your eyes, glasses, and glaucoma, and your ears, including hearing aids, and all your prescription medications with no cost sharing. If there are medical needs, you do not pay extra. So, New York Health offers coverage as good or better than any plan offered in New York State today, and it's far better than most. And it has no restrictive networks. It gives you choice of doctor, hospital, physical therapist. If you live in Albany and get sick while visiting a friend in Buffalo, you're covered for your Buffalo Medicare. Ditto if you're hiking in Vermont. It's affordable. 90 to 95% of New Yorkers will pay less for health care, or far less than what they pay now. And people who earn less than 25,000 will pay nothing. And if you earn 75,000 a year and you work for someone, you'll pay about 1,000 for all your health care. And your employer will pay about 4,000. Unless you're in a union that has negotiated that your employer should pay 100%, and then you'll pay nothing, and your employer will pay 5,000 if you're making 75K. And if you work for yourself, or you don't work and your taxable investments pay out 75,000, then you'll pay the full 5,000. But consider what you're paying now. As you earn more, you and your employer will pay more. But 90 to 95% of New Yorkers will pay this far less than they're paying now. That means you're likely to be earning more than $300,000 per year to pay as much for health care as you do now.
So that almost sounds, Judy, like it's too good to be true. So there's clearly a lot of extra cost to the state. So where do the savings come from? Can you explain how that part of the New York Health Act works?
As I said, when I first heard about it, I said, how do the numbers work? So this is a question that is near and dear to me. So one way to think about it is to think about how insurance works. As you spread risk across more and more people, you reduce the cost of a risk to any one person. So New York Health will have 20 million of us in the same risk pool. So the cost of hugely expensive major operations, catastrophic diseases, automobile crashes is going to be spread across entire New York State, which is a viably large risk pool. It is a risk pool larger than most countries. But even with spreading that risk, which is not what's currently happening, um, we'll have savings. First, as I mentioned, it removes middlemen who do not provide health care. They take profits and engage in fraud, and they overcharge on overhead. Medicare and the VA have only 1.5%. Private insurers have up to 20%. Altogether, this will save about $20 billion a year. That's a big number. Second, by removing the for profit middlemen, it will reduce the provider overhead. All those folks in billing offices and in doctors and hospitals. One anecdote: Duke University Medical Center has about 1,000 beds and 1,600 billing clerks. That's 3 clerks for every 2 beds. But the University of Toronto Hospital has 1,250 beds, somewhat more, and only 7 billing clerks, or about 1 clerk for every 18 beds. And 2 of the Canadians focus on Americans. So reducing provider overhead will save about $16 billion a year, almost as much as getting rid of the middlemen.
Those are pretty powerful numbers. So, in terms of savings. So, one of the things, Judy, that people will probably yell about is the fact that, oh my gosh, you're going to be putting people out of work. So, hospitals are big employers in rural areas as well as in other places in New York State. What happens to these administrative jobs if the New York Health Act is enacted?
That's one of the wonderful things about this bill, that in its 30 years of being discussed, evaluated, was revised. The text of the bill says anyone who loses their job because of this law will receive at least 2 years of extended unemployment insurance, job retraining, job placement assistance, and priority hiring for new jobs created by New York Health, of which there will be quite a lot. So let me ask, so people will be taken care of, and and the premise of the bill is that when they can, they will extend benefits if someone's close to retirement. So let me do the last area of savings. New York will negotiate prescription drugs directly with manufacturers. You may still get your drugs dispensed by local pharmacies or by mail, but there's no cost sharing. So, a bit more background. Reports, these are U.S. Congress, estimate that Americans pay 7 to 10 times more for the most common drugs than peer countries. These are the same drugs made in the same factories, sometimes in the same packaging, if you'll notice foreign languages on the backs of your instructions. How can this be? Well, other countries negotiate drug prices. The VA, which covers 9 million veterans, negotiates a 50% discount on its drugs. New York State has 20 million patients and will surely be able to negotiate at least that much or more. But figuring out that 50% will save over 18 billion a year. Altogether, estimated savings from insurer administration, provider administration, and prescription drugs total a savings of 55%. So that's a big number for New York Health to save.
I love the fact that they've thought ahead about what happens if someone loses their job, because nowadays, if you lose your job, you're on your own. But under this program, they've actually created a great system to make sure that people aren't going to be hurt while they are retraining or getting ready for a different industry. And that is a terrific, well thought out part of this plan. So you just talked about 55 billion in savings, which is a huge number, but won't the cost be even higher? How can it cover everyone for all these services and yet no one ends up paying anything out of pocket?
That's one of the beauties of single payer. So we get 55 billion from 3 areas, and the added costs also come from 3 areas. First, covering everyone and eliminating all cost sharing, so you have no co-payments, no co-insurance, no deductibles, no caps, will add about $17 billion. Now, New York State is going to be covering more people? Yes and no. In fact, New York State covers almost everyone now for emergency care. And emergency care is the most expensive kind of care. If we could move all those people who only see the doctor when things are completely dire into lower cost routine and preventive care, we would be swapping out very high price care for something that is considerably less. And that is one of the reasons why covering everybody and making sure they have a doctor locally will save a lot of money. Secondly, or at least it won't cost as much. It will the costs of how we're serving them will drop, so serving more people and more visits will make more sense. Second, New York Health will raise reimbursement rates for providers to more than the average of what private insurers pay now. So doctors will be made whole. And what that means is that a doctor who is working in a rural area will be able to actually live without worrying and not working 18 hours a day, 9 hours of which is on paperwork. This will add about $9 billion in cost. And third, New York Health will pay for long-term care for everyone. So no household will worry about losing the family home or doing spend down or means testing. Healthcare is something you should get as a New York resident or as an American, but let's start with New York. And this will add about $18 billion a year. All told, these add up to about 44 billion. So it's estimated that New York Health Act will net a savings of about 11 billion a year, about 3% off the current spend.
So let's just talk about those numbers for a second, Judy. Where do you get them and can we trust them?
My kind of question. So in 2017-18, the New York Health Foundation, which is a nonprofit, non-governmental, but it does a lot of scoring of government plans, paid $400,000 to the Rand Corporation, who most of us have heard of. It is a incredibly well-respected group that figures out complicated analyses to study New York Health Act. And these numbers came from detailed analyses by Rand, which was the first time that New York's cost of healthcare had ever been calculated, because you need to know what the total cost is to know how much you're going to be adding or subtracting. But part of the reason you can trust Rand is because it's Rand, and part of the reason you can trust it is because the results were similar to the 3 dozen other credible economic analyses of federal and state of proposed federal and state single payer programs. Every one of these analyses has concluded the single payer costs less or about the same to cover everyone.
So let's, as we get to start to wrap up here, Judy, what's your bottom line on this bill and what will it mean for individual New Yorkers if we can get it passed and signed into law?
Well, I guess I'd say 2 things. First, you will only pay the New York Health tax. There's no cost sharing, no copays, no deductibles for prescriptions, for physical therapy, for acupuncture, for any of this. And when you arrive at the ER or your doctor's office, they'll ask, "What's wrong?" They won't ask, "How will you pay?" And second, New Yorkers won't worry about medical debt. If you lose your job, you won't lose coverage. And if you hate your job, you can change it. And no one will have to stay with a spouse because the spouse gives them health care. As a New York resident, you'll be covered because you're a person. And I would say one more thing. Rural residents may well have doctors living a lot closer down the road because doctors will be able to afford to hang out their own shingle or maybe to hang out their shingle with a couple of other people because they will be treated fairly by the reimburser. And that is huge. And medical malpractice insurance will probably drop, as it has in other countries. But we can go into that another day. That's a very nice subject.
So, Judy, what can we as citizens do to help advocate for better and expanded health care, both in the budget and during the legislative session, which is in the post-budget season? What kind of advocacy is needed to get something like this finally across the finish line?
Well, first we need awareness. So I would recommend people join the New York Health Campaign at nyhcampaign.org. It's free to join, although donations are always welcome. And you can help build regional hubs of individuals and organizations. So go to the campaign website and then talk to every organization that you belong to. And second, Donna will post a page of where to learn more and
Mhm.
opportunities to get involved because this is something that we all need. Thank you.
Thank you. This has been a fascinating conversation. It is so incredibly timely as as we're going through the budget part of the New York State session right now. And healthcare is something that's on everybody's mind, uh, whether they need it or they think they need it or they know someday down the road they're going to need it. And costs are always on people's minds. So, Judy, thank you so much for all your work, your advocacy, and how you have helped us to understand what the New York Health Act will actually do for us. So we really appreciate your time and your expertise.
Well, thank you, Donna. And let me say, I appreciate the range of topics that North Country Matters covers. You really do a great job, and I've recommended it to lots of people in my suburban areas and urban areas. So thank you.
Well, thank you so much. And, we all have the same problems. They just look a little different depending on where we live. So let me remind folks that these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.